This rule deals with several important bills that will lower health care costs for Americans and protect children, Mr. Speaker. One of the bills, H.R. 3492, the Protect Children's Innocent Act, is led by Representative Green from Georgia. This bill prohibits genital and bodily mutilation and chemical castration for a minor, which generally is anyone under the age of 18 years, while also preserving the exception for this care if there is legitimate medical need for certain procedures. Another bill we are considering in this rule is H.R. 498, the Do Not Harm in Medicaid Act, led by Representative Crenshaw from Texas. This is a simple bill that prohibits federal Medicaid dollars to pay for gender transition procedures for individuals under the age of 18. The bill also includes protections for individuals if some of those treatments are medically necessary. These are important bills to ensure that federal taxpayer dollars are not going towards a minor's gender transition surgery if it is not medically necessary. These bills also put guardrails in place so minors cannot make permanent life-altering decisions before they are 18 years of age. Finally, we are considering H.R. 6703, the Lower Healthcare Premiums for All Americans Act, led by Representative Miller Meeks from Iowa. This bill lowers premiums for Americans, creates more insurance options, brings greater transparency, and cuts red tape. Unlike our Democrat friends' plan, our Republican plan actually lowers premiums by double digits, roughly 11%, according to the data. All the Democrats want to do is throw billions more dollars towards insurance companies. Instead of attempting to lower the premiums of the individuals who are on the insurance plan, the Democrats created, which should be called the Unaffordable Care Act. The Democrats have cried wolf that Republicans are responsible for premiums being unaffordable. But let's get the facts straight. Every single Democrat voted in support of the so-called Affordable Care Act. They claimed people's premiums would be lowered, patients would have more choice, and if you like your doctor, you can keep him or her. However, just the opposite has happened. Their so-called Affordable Care Act has caused premiums to skyrocket. Because of this, the Democrats are too afraid to own up to the fact that their health plan has failed to actually lower premiums. So instead, they have said to themselves, hey, instead of acknowledging our failure, let's just blame the Republicans for that failure. I distinctly remember a hearing at Energy and Commerce shortly after I was elected, where most of the witnesses said the so-called Affordable Care Act was going to make insurance premiums go up for Americans. That was over a decade ago, Mr. Speaker. But the Democrats on the committee insisted the witnesses were wrong, and the Republicans were merely trying to scare the American people. Unfortunately for the American people, Mr. Speaker, the witnesses were right. The so-called Affordable Care Act has, in fact, negatively impacted the price of health insurance in America. This plan, the so-called Affordable Care Act, is a major reason your insurance premiums have gone up and have done so repeatedly. And when not blaming Republicans for the failures of this so-called Affordable Care Act, do you know what the Democrat solution is? Folks watching this debate at home won't be surprised to know it. Democrats want to throw billions of additional dollars to health care insurance companies in an attempt to distract the American people from their own policy failures. I don't know if you all have been following the news closely, but the insurance companies the Democrats want to give an additional $85 billion to with their 3-year clean extension of the temporary COVID-enhanced premium tax credits, those insurance companies, they have not been knocking on the doors, Mr. Speaker, of the United States bankruptcy courts seeking protection or aid. In fact, they've been making record profits. Further, we know these temporary COVID-enhanced premium tax credits have been riddled with waste, fraud, and abuse. The Independent Government Accountability Office recently came out with a preliminary report that showed one Social Security number was used to receive over 125 different insurance policies in 2023 alone. That's fraud. But there's also a huge amount of waste. Mr. Speaker, my estimate based on data I've seen is that roughly 20% of enrollees in the temporary COVID-enhanced premium tax credits don't really exist. They are shadow enrollees. Let me explain. In most healthcare insurance plans, you generally have about 15% of the enrollees who make no claims in a given year. But in the arena of the temporary COVID-enhanced premium tax credits, that number for those particular policies that have no claims is closer to 35%. There's no reasonable explanation, Mr. Speaker, other than those extra 20% of people not making claims don't really exist. Now, I call this waste and not fraud. And that's because I actually believe the insurance companies don't know which enrollees are shadow enrollees. How does this happen? Well, it's a glitch in the way the bill was written originally. People move around. So if you signed up for a program in North Florida to receive the enhanced premium tax credit, and then you move to South Georgia or even another city in Florida and you sign up again thinking, well, I've moved, I probably need a different plan, the consumer has a right to believe that somebody at their new plan or new company will notify the old carrier that they've switched policies. But the way the program was designed by our friends on the other side of the aisle, that never happens. And because you are automatically re-enrolled each year, this can go on for years. Thus, over time, you build up to that 20% of shadow enrollees. We cannot, in good conscience, in defense of the American taxpayers' money, we cannot just cleanly extend these temporary COVID-enhanced premium tax credits without addressing the realities behind the waste, the fraud, and the abuse that is occurring in this program. I also find it interesting that the Democrats voted twice to extend these temporary enhanced premium tax credits, but specifically did not make these premium tax credits permanent. They didn't do it. They had many opportunities to make these permanent if they wanted to do that as much as they say today, but they didn't. They had many opportunities to make these permanent if the premium enhanced tax credits were as imperative to make the system work as they will claim here on the floor today and have been for several weeks. But they didn't do it. Whose fault is that? Logic would tell you it's the Democrats' fault. But when it comes to health care, the Democrats are never willing to admit their policies failed. So what do? Blame Republicans. The Inflation Reduction Act, in the Inflation Reduction Act, Mr. Speaker, the Democrats prioritized giving out around $1 trillion to Green New Deal initiatives instead of making their temporary premium tax credit program permanent. The fact is, even they couldn't find the votes when they had control of both houses in the White House to make the enhanced premium tax credits permanent. And now they're demanding Republicans do what they could not do and clean up their mess, which was an add-on to the so-called Affordable Care Act. I can't make that make sense. And Mr. Speaker, I bet you can't either. So what are they asking for now? You guessed it, another temporary extension that fails to address the underlying causes of the skyrocketing costs, doesn't deal with the waste, fraud, and abuse, and worsens health care access caused by their so-called Affordable Care Act. Nope, instead, they just want to blame Republicans, use it as a political issue, and give more money to insurance companies making enormous profits. What the Republicans have drafted is a plan to address health issues across the board for our people and for our nation. This bill brings more transparency on the pharmacy benefit manager, middlemen, better known as PBMs, for employers. For too long, PBMs have gotten away with operating in a black box and causing drug prices to rise. We are bringing transparency into the commercial market for PBMs under this bill. The bill also expands access to association health plans, which allow small businesses and self-employed workers to band together and purchase health insurance. One of the biggest complaints we hear from businesses, especially small businesses, the rising cost of premiums that they have. In fact, Mr. Speaker, Virginia tried to create these plans, and CMS told them they couldn't do it, that they would penalize them. And the Virginia Association of Realtors, let's see if I got the name right, in an article from 2023, the leader said that they would create a plan for 7,000 association members who are uninsured because they don't make enough money to afford the federal marketplace. That would be the so-called Affordable Care Act. They don't make enough money to afford the federal marketplace coverage or to qualify for subsidies in the small group and individual plans. These small businesses don't have the bargaining power that larger businesses do to help lower their premiums. Allowing these small businesses to join together and have more bargaining power will help lower their health insurance costs. Another part of the plan codifies a 2019 Trump administration rule that allows employers to give tax advantage dollars to their employees who can then use those dollars to purchase health insurance and for other medical costs. When businesses are planning their financial future, unpredictable health insurance costs and rising premiums make it almost financially unviable in some cases. Allowing businesses to have this option brings them more certainty and will give power to their employees to choose a plan that is best for them. Another flexibility we grant under this bill, under this bill, is by exempting stop-loss insurance from the definition of health insurance coverage. Stop-loss coverage is a type of coverage for an employer who can purchase them to protect the employer from unexpected catastrophic health claims if that employer has chosen to self-insure their employees' health care. This allows an employer to limit the financial risk imposed on them if an employee or a few of them have unusually high medical claims that exceed the budgeted amount. Some states have attempted to restrict or prohibit these plans, which make a self-insured option less attractive. This bill clarifies that this type of coverage is exempted from the definition of health insurance coverage, which means that these states would be limited in how they can regulate stop-loss coverage while still allowing it to follow the regulations of ERISA. On top of all this, I would like to reiterate that the bill lowers individual premiums who are enrolled in the so-called Affordable Care Act plans by roughly 11%. It does this by appropriating dollars for cost-sharing reductions. This will stop the practice of silver loading by putting dollars towards lowering beneficiaries' out-of-pocket costs, which in turn lowers premiums for Americans, again, by roughly 11%. Those Americans who are on the so-called Affordable Care Act. Today you will hear, Mr. Speaker, you'll hear my friends and colleagues on the other side, the Democrats, tell you this plan is not meaningful and that the only way to help individuals is to throw more money at big insurance. Throwing more money at the insurance companies, Mr. Speaker, is not the answer.